first question, and you will see as you follow along that wellness plan really mirrors the order of these slides. So what does it mean to be well? What would we look for if we see somebody and say that person's well, right? What would tip you off? Okay, so mood, happy, engaged, present, sure, great, able to focus, sure. An impending sense of dread sounds very clearly not a clear indicator of feeling well, okay.
Having the capacity to help others.
Mm.
Your bucket runneth over, so you can share that at that moment. I like that. Aware of your emotions, right? You can do that check-in with yourself. You're not just going through the motions of the day.
One key point of this slide is that there are many aspects of ourselves and our lives that we look to, that we can consider feeling well or a bit unwell. We are talking about physical health, we're talking about social health, mental health. Yeah. These are all connected.
I would say for me, being able to sleep through the night, that's always a good one. And we know when our sleep is off kilter, a lot of those stressors can come up, as we talked about before.
Yeah. For me, being able to be present, focused, and not stuck in my head or critical. Yes, those are key signs for me. I think the goal here is to generate a bit of thinking and really help people reflect that being well mentally is a much broader than just symptoms, right? We are really trying to get people to generate that concept on their own. For this wellness plan, there are really 4 key components, 4 areas at least that we're going to focus on. These are the 4. We'll go through them in turn, starting with sort of proactive, preemptive wellness. There are kind of 2 different ways to work on your wellness. One is the things you do every day because they keep you well. So that's where we will start. Second is warning signs. Your ability to notice that you might be starting to feel a bit unwell. Third then is triggers. So if you've noticed you started to become unwell, you need to know what the things are that tend to push you there, right? Knowing yourself, I think, is key. These are all part of the preemptive coping. And then the last is the sort of reactive coping. So once you've noticed that you have started to show some of these signs, what are some things that you can do to reduce signs of feeling unwell and push you back into your area of wellness? So both preemptive, knowing your warning signs, and some of these reactive strategies. So wellness plans are important. Most people don't make these, right? Most people, you may know yourself, most people don't have this written out. It's particularly important for those who are seeking help and support at a clinic and for their family members for a couple of reasons. It really helps you cope ahead, right? It helps you build in a routine and a daily life that incorporates some of the things that might prevent these signs of unwellness from popping up. It can help you plan, right? Knowing where you've been and knowing what's helped you in the past can really help you plan for when something does show up. What have I done in the past? What could I do now? Yeah, and it helps to prepare you. I will say it is also really useful for family members, because for any of us, in the moments when we're already feeling unwell, this stuff is harder for us to access mentally, right? When you're in it, it's harder for you to express what you need and ask your loved ones to do things to help you. So if your loved ones already know this stuff, they can kind of jump in, right? You can have these conversations beforehand. When I'm feeling unwell and you ask me, are you okay? Are you okay? Right? That's actually stressful for me. Knowing that ahead of time, just as an example, that's a common family dynamic, right? Those are some of the reasons these are important. So thinking again about this model, we plan ahead to reduce the likelihood that we hit that line. So we talked to you about our various treatment approaches before. So our goal is to bring people from right to left, bring people right. If you know what your stressors are, can help to bring you from top to bottom. If you know what keeps you well physically, right, you can kind of move people from right to left. Okay. Just to orient you to your handout, I think we've maybe done a pretty good job of this. You will want to do this with your families in the room.
And I just want to add that this is adapted from Connections and Care, Symptom Management and Relapse Awareness Guide to Relapse Prevention. So I just want to give credit there.
Yeah.
We've adapted this.
We packaged it sort of differently, but we did not make this. Yeah, thank you. So jumping into the first section. So the first section is things you do, that preemptive coping, things you do to stay well. So what are some of the things you all do or we do, maybe every day, maybe frequently, because we know in the long term, it keeps us well. If you're playing along at home, go ahead and write these down on your sheet too as we go.
Have to develop healthy habits, drink lots of water, good sleep, structured bedtimes. Great.
I think we want to emphasize that these are different for everybody. Knowing yourself is key. Regular exercise.
Yes.
I know for me, actually, as an extrovert, like if I'm in my house for too long, that's no good. So having some outlets to like be around other people is a key part of wellness for me personally.
I'm opposite. I need a little recharge time alone after a lot of socializing. So too much of that might push me over the edge, right? I don't know if you saw on the previous slide too, attending therapy sessions regularly, that can be a part of, I know when I go to those regularly, that's helpful for me. You can go back to that slide just to get some idea.
Now that you've had a few minutes to write things down, let's share. So it's kind of like two opportunities. Let's share what you came up with. Anybody have things they wanted to add?
I was going to say, getting a good snuggle in with my cat. You already met her tail.
Talk to a friend. Yeah. Okay. Venting. Right.
And again, this is very different across different people. Encourage that individuality here.
Good point. So some skills are good both as preemptive and reactive, like deep breathing. Having mindfulness practice, meditation, or just deep breathing on its own. I noticed that when I listen to great music, I always feel better afterwards. So building that into my life is key. Coming home to a tidy house, I like it. Feels good. Okay, great. So hopefully at this point in your workshop, you've had some good discussion.
Right. So we will move on to our next part of our wellness plan. So a critical step in creating your wellness plan is also recognizing signs you are starting to feel unwell, right? And so you may have recognized various symptoms, behaviors, or feelings that happened before you're feeling unwell. And if you did not notice any of those things, maybe even others around you may have noticed. So that's where it can be very helpful to have family members here who are able to provide some of that context. And so whether you recognize it or whether others recognize it, these are called warning signs. And most noticeable, they can start, weeks before or months before a relapse. And here we're considering a relapse. We use this term to describe that return of symptoms after a period of being well. And so a really important part of this process is identifying your early warning signs or warning signs in general, that a relapse is coming. It also may be helpful to break your warning signs into different categories. So here we have some examples of early, middle, and late warning signs. So you are also aware of the order in which your warning signs have occurred. So if, for instance, if we thought of someone who had an allergy to shellfish, what are some of the early, middle, and late signs that you're having an allergic reaction?
I might think an early sign is hot, flushed, maybe.
Itchy, yes. Yeah. Swelling, yes. And so, right, you may notice some things at first and they may worsen over time. So, right, for me, I thought scratchy throat, feeling hot, and then maybe building up on that middle, seeing hives, swelling, and then maybe towards that late warning sign, you may already be having trouble breathing, right? And so, shifting back to kind of your own experiences, what are some of the warning signs you notice in yourself?
Early,
Calling,
middle, or late
mm,
calling out.
calling out from work. Got it.
Yeah.
Mhm,
I know for me, my brain gets stuck. That's like middle.
mhm,
Thought I get stuck on whatever it is.
Little rumination. What about what make others around you notice too? Some of these are things that others can notice, but something like being bored, maybe other people don't notice that. What are some things that others might notice about you in that early, middle, or late phase? Getting angry easily. Yeah.
Yeah.
Quick fuse, right? Mhm. Hmm. Eating as much, right? They might notice that.
Less responsive to calls, texts.
Mhm. And again, some of these, might fit at different points on that early, middle, late, and they could be different for different people too. You might have an earlier warning sign of one of these that other people don't. Early symptoms can sometimes look like negative symptoms. It can be hard to identify. As we talked about before, those mood and negative symptoms can sometimes have that little bit of that overlap. That can be hard to notice too.
Another good reason that we do this with loved ones or support people, right? Because you have a chance to notice things about the person you're there with. Giving a kid a chance to notice this about the parent, right? If that is okay for them and their family, it can be very normalizing also.
Definitely. Great. So, just to walk through a little bit more of each of these different categories, some early warning signs may be things you may not be too distressed about, are, noticeable and they get in the way. You have trouble concentrating, you feel nervous, difficulty sleeping. Maybe in that middle level, this might indicate you're becoming more distressed by things. So your coping strategies might be to avoid things or little things set you off in a big way. So this might be, not talking to friends, not attending school or work, feeling more irritable. We talked about a couple of those. And then maybe some late warning signs are things are getting pretty serious. Maybe you're isolating, staying in your room. We talked about someone brought up being disheveled, so maybe not showering, taking care of your hygiene. Maybe more internal experience, feeling numb, like moving from that bored place all the way to feeling numb. And so the goal here is to better recognize these early warning signs so that you can put your wellness plan into motion quicker and getting support doing that. That's a big component here. And then I just want to share, you also have this handout in your resources. It's called Common Early Warning Signs Handout. And specifically, we've come up with some that may be more common in psychosis, but you can see that a lot of these are applicable to many people. So like that normalcy, that validating your experiences, that this is a pretty common. And so we hope that this maybe can start to generate some ideas for you if you're having a tough time identifying your own. And so if you want to take out your worksheet, you can start to fill out these different categories for you. What are some of your early warning signs, middle stage, as well as late warning signs? And then we would come back together and say, let's share. If you're working on your worksheet, yeah, keep working on it. That's okay. Keep thinking.
For all of us, we're all vulnerable to something, right? This is very normalizing. We're all vulnerable to something. So, as stressors build, whatever we're vulnerable to is likely to come out. It's this like process. For parents, it might be frustration, anger, anxiety. It have to be psychosis.
Yeah. Overwhelm, bringing work home. Again, some of that, having a hard time letting things go.
I know a lot of my late ones are very anxiety focused.
I'm an avoider. Yeah. I can relate to that one. Again, normalizing these experiences.
For my middle, I can be a catastrophizer or a glass half emptier. People notice that. So like worry and critical bits.
Yeah. Definitely a slow, I think in the middle, slower to respond to friends, maybe takes a week. Yeah. Again, this is an ongoing process. So even if you don't think of things right now, you can always go back and edit them, add things. So next up, as we had heard earlier, it's important for us to anticipate situations or stressors that may cause you to start to feel unwell. And this we think of as triggers. So thinking about our analogy earlier, again, let's, outside of the shellfish example, what are some other things that people are allergic to, or could be a good analogy here? Like we said, the flu earlier. What are some other things?
So what might a trigger be in diabetes?
Too much sugar.
Something that sets off the issue, yeah.
We have some other ideas of flowers and trees, like the springtime is an allergy that you notice. So your triggers are maybe specific types of pollens, right?
Particular foods.
Yeah. Totally. I got a couple food allergies. I understand.
Trigger sort of sends you in a given direction.
Along with the diabetes, maybe you already have diabetes, but a trigger for it to worsen or come back is running out of medication or not taking your medication as prescribed. And so now I want you to think of, what do you experience when you have an allergic reaction? And then does this impact what you do in your behaviors? I've been thinking about the shellfish analogy, maybe in your early warning signs, for you, like getting hot and having itchy throat might mean it's time to take a Benadryl, right? So that might be like, okay, we can stop this before it gets too bad, kind of situation. Versus I'm at the I can't breathe stage, so I need my EpiPen, right? So different types of interventions at different points. Maybe depending on how intense the trigger was too. Once you notice your trigger, what do you do? Let me jump in a little bit more with some background on triggers. So, we're talking about triggers, and these can be the things that lead to warning signs and symptoms. So those things that are impacting you more significantly, depending on what's going on. And so we can think of triggers as the things that set things in motion, leading to a relapse or seeing our symptoms worsen if we don't intervene. And so we have some different situations or events can sometimes be triggers. So, right, what are some example situations that you could imagine that might be triggers for you? And Dr. Shapiro, if you want to jump in.
Yeah, I think for this section, so we've set the stage with an example, like an allergy example. And so now our next goal is to say, what are some of your triggers? What trigger what tend to trigger those early warning signs for you. So these can be situations or events, mental states. Those are good things to encourage people to start writing in their section here.
So again, for me, maybe as a little bit more of an introvert, being in too many social situations in a short period of time, right? That might be one of my triggers.
So what are some of our triggers? The things we know make it more likely for us to feel unwell, that tend to set things off. Yeah. Social stressors are big ones for me. A fight with a loved one or family or friend. That's a key trigger. A deadline is a trigger for me. I know I'm more likely to show my signs of unwellness or symptoms.
Lots of situations from poor sleep, some social situations.
So you can see the logical progression here, right? The things you do preemptively to stay well, the signs. So maybe we want to take a minute or two, fill out our own triggers.
There's some that maybe you feel comfortable sharing in that group space. Well, you might keep some of them to yourself. And again, maybe you keep this as a ongoing document, and when you notice different things, you can add to it, because often, sometimes it's hard to retrospectively recall some of these experiences. And so if you remember in the moment, you can add to it and have a record and can build off of that in the future.
We would give people a couple of minutes to work on this. So by this point, right, we've got a wellness plan with our first 3 sections. We talked about preemptive coping. Now we're talking about reactive coping. So this is the last section. You've now noticed some signs of being unwell. You've hopefully been able to label them as early in that flow as possible, but not necessarily. So the question then is, what do you do? There are things we can do when we're feeling distress with the idea of reducing that distress. Anything that works for you is great. You got to test them out to know if they work. Usually there's some experimentation, but we can start to think about that by looking at a few different classes of coping skills. That reactive coping. Sign of unwell has popped up. You apply a thing in the hope that now that sign of being unwell is going to go away. So these are things like self-soothing skills. There are some examples on this sheet. Maybe you've considered them. If not, maybe you want to talk to your clinician about them. Sensory soothing is nice here. You can use your senses to distract or soothe. A warm bath, something that's pleasing to smell, as appropriate, a treat. Distraction skills are really key ones, really key, particularly with psychosis. Things that you can engage in that occupy your attention. We know as providers that, our mental resources are finite. So when you are focused on what's distressing you, if you can focus on what's something else, you kind of overload the system, right? You move those finite resources elsewhere. Good DBT skill is this opposite action. Concept here is often our responses to distress maintain that distress. Avoidance is a really good example. So opposite, if you know that about yourself, opposite action is a nice skill. Do the opposite of what your impulse is. If your impulse is to withdraw and curl up, go for a walk. If your impulse is to be really critical, do something accepting or find something funny or cheerful. Inducing some positive emotion is a key one. Mindfulness, these can be useful strategies, ways to focus yourself in this moment. Try some grounding skills or guided meditation. Focus on your senses to ground yourself. So what are some reactive coping strategies that you all use, that bring your distress down in the moment?
Something bad happened, like engrossing myself in a good TV show that will keep my attention.
Distraction, music, laughter. Laughter is surprisingly effective. Somebody to talk to, venting. A walk, yes, moving your body. A walk is also a good way to change your setting. Distress has popped up when you're in one place. A walk helps you perhaps remove some of those triggers. Cell phone games, distraction, journaling, using an app. Great strategies. Let's take a minute.
Different situations might call for different coping skills. Absolutely. So if you have a specific wellness plan that's about maybe specific sets of triggers, having one flow for that, maybe you create more than one wellness plan, right? That has some different focus.
Yeah, good point. Can't take a shower while you're at school. The last section, you're following along, right? Preemptive coping. We know our warning signs. We know our triggers. Warning signs have bubbled up. You try a coping skill. What if those have not worked and things continue to escalate? So the last part of this wellness plan is the crisis safety plan piece. In case symptoms come back and these don't work, who can I call on? My own strategies have not been effective. I now need to pull in some outside strategies. So usually the first step is there a safe, comfortable place I can withdraw to, right? Sometimes you do need to leave school, right? You get overwhelmed or work. Sometimes you may need to go and have your room, be able to spend a little time by yourself. If that's not working, the next step is, can you pull somebody else in? You call your parent. Can you call your best friend? And what can they do? What would you like your loved one, your support person, your friend, your coach, your pastor, rabbi, right? Your whoever is on there. What, now that you're feeling pretty good, what would you want them to say to you when they're not? Maybe it's like, well, let's go for a walk together. Maybe it's you want them to remind you of something. Okay. And then the last step is your emergency plan. Right? If we're really in an emergency here, where do you want to go? Who are your doctors that you're going to call in a pinch? They're not there. What are the emergency contacts? This is really something developed within your family or with your providers. So we want to encourage you to do that as the next step.